Colon cancer rarely announces itself with pain at the beginning. It usually starts quietly, with changes so small that most people brush them off as stress, aging, or digestion issues. And while colon cancer has long been associated with older adults, something concerning is happening right now. Rates are increasing fastest in people between the ages of 20 and 50. This isn't because our genes suddenly changed. It's because our environment, our food, our stress levels, and our gut health changed rapidly, all within a single generation. The important thing to understand is this. Your body almost always sends warning signals early. The challenge is knowing which ones matter. Today, we're going to walk through 10 early signs of colon cancer that should never be ignored, especially if they persist or appear together. Sign number 1, iron deficiency anemia. Anemia means your blood cannot carry oxygen efficiently. Specifically, iron deficiency anemia happens when your body loses iron faster than it can replace it. When colon cancer is involved, the reason is often slow, invisible bleeding inside the digestive tract. Unlike bleeding from the stomach, which often causes dramatic symptoms, bleeding from the colon tends to be gradual. So gradual that you don't see red blood, you don't feel pain, and you may not notice anything unusual for years. Tumors form fragile blood vessels to feed themselves, a process called angiogenesis. These vessels break easily, leaking small amounts of blood over time. The result? Iron levels drop quietly, oxygen delivery falls, and the body struggles without obvious warning. Sign number 2, ongoing fatigue that doesn't improve. Persistent fatigue is often blamed on stress, poor sleep, or getting older. But when fatigue is unexplained and doesn't improve with rest, it deserves attention. Low iron reduces oxygen delivery to muscles and the brain. At the same time, cancer-related inflammation releases chemical messengers that interfere with your mitochondria, the structures responsible for energy production. This creates a deep, draining tiredness that feels different from normal exhaustion. It doesn't reset after sleep, and it slowly worsens. Sign number 3, subtle darkening of stool. Not all bleeding is visible. When small amounts of blood mix with stool higher in the colon, it may darken slightly. Not black, not red, just darker than usual. Most people never notice, and even if they do, they assume it's something they ate. Because bleeding may come and go, stool color can appear normal one day and darker the next. This is why stool testing exists, to detect blood the eye can't see. Sign number 4, changes in bowel habits. Your intestines are controlled by a complex network of nerves called the enteric nervous system. Tumors can disrupt this system through pressure, inflammation, or chemical signaling. When this happens, bowel movements may change. More frequent. Less frequent. Softer. Harder. The key is change, especially if it lasts weeks or months. Colon cancer is now one of the most common cancers worldwide, and its rise closely follows declines in gut health, microbial diversity, physical movement, and stress resilience. Sign number 5, bloating, gas, or feeling full too quickly. As tumors grow, they can partially block the intestinal passage. This slows movement of food and gas, causing pressure, bloating, discomfort. Early fullness after eating small amounts. Slower movement also leads to increased fermentation, producing more gas and irritation. Many people mistake this for food intolerance or indigestion and never investigate further. Sign number 6, tenesmus, constant urge to go. Tenesmus is the persistent sensation that you need to have a bowel movement, even when nothing happens. It often feels urgent, uncomfortable, and incomplete. This is common when tumors are located near the rectum or sigmoid colon, where stretch receptors trigger the urge to go. A mass in this area mimics fullness, sending false signals to the brain. Sign number 7, pencil-thin stool. Occasional thin stool can happen to anyone, but consistently narrow stool is different. It suggests that something is reducing the diameter of the intestinal passage, forcing stool to change shape just to get through. Many patients later report months of this symptom before diagnosis, often without pain or bleeding. Sign number 8, alternating constipation and diarrhea. When stool movement becomes obstructed, the bowel may respond by releasing water to flush contents through. This can cause cycles of constipation followed by loose stools. While conditions like IBS can cause similar patterns, persistent changes should always be evaluated, especially when combined with other signs. Sign number 9. Visible blood in the toilet or on paper. Blood that appears bright red often originates near the rectum or anus. This is frequently mistaken for hemorrhoids, and in many cases that's true. However, tumors bleed more easily as they grow and become structurally disorganized. The more advanced the tumor, the more fragile the tissue, and the more likely bleeding becomes. Blood should never be ignored, regardless of assumed cause. Sign number 10, unexplained weight loss. Rapid, unintentional weight loss is one of the most serious warning signs. Tumors disrupt hormones that regulate appetite and metabolism. They increase inflammation, accelerate muscle breakdown, and raise energy demands. As tumors grow, they also steal nutrients directly. At later stages, this can lead to cachexia, a severe metabolic state marked by muscle loss, weakness, and declining quality of life. Colon cancer rarely begins with dramatic symptoms. It begins with subtle signals that are easy to dismiss. Understanding these signs gives you power, not fear. If symptoms persist, overlap, or worsen, early evaluation can be life-saving. Your body speaks early. The key is listening.